Hello, everyone. This is Shad Race from CVI 2025 in Austin. I'm really privileged to be with Dr. Zach Rosol, who has multiple presentation at
I
CVI this
do.
year, but we're going to focus today on pulmonary embolism. Zach, thanks for being with us again.
Of course, happy to be back.
Yeah. So PE field and thromboembolic disease, or
Yeah,
VTE, is evolving quickly. Catheter technology, indication,
right.
trials. So let's start by what's new in the pipeline.
What's new is that we hopefully are going to get some guideline direction here, which I think will only help expand our indications and hopefully improve our treatment algorithms, right? So we've had a couple of randomized trials that have come out. We just finished enrolling in STORMs, randomized heparin versus thrombectomy trials. I just think we need to grow. Those of us that do these, and I know you're including that, we see that it works. We know these people are really sick, but I think we need to grow that evidence base. And so I'm excited as these further trials get published to move that field along. And I think we're going to better understand who, when, and maybe which device is better to help certain patient populations. I think that's where the field is going.
Yeah. So from your experience, is which patient will benefit the most from thrombectomy based on your experience and the guideline and the trials?
Yeah, so I think those that are presenting within the first week. Okay, I know we say sometimes people who have symptoms within the first 14 days. In my personal experience, I've seen that those that present and they have elevated biomarkers, but that it's only an elevated BNP and their troponin levels are not elevated, those patients are more in a subacute presentation. Okay, and I think we need to better articulate that. It's tough to measure success, right? With these procedures, we're looking at pressures and PSATs that go up as markers to stop. It's not like a coronary intervention, right? Yes, we all give ourselves a pat on the back. We can put an IVUS catheter down. We know. So the patient selection is really key. And those that are, my biggest thing has been if the troponin level is elevated, that is someone that I think I can absolutely help, and we match that with their hemodynamic state and their CT as well.
Now, the catheter, in terms of catheter or the therapies we have now, we're not going to go in which device is better than others, but they're getting smaller, more effective, and more powerful.
Right.
So, do you have a certain catheter for certain indication or certain disease state or tree that we're involved in?
I think this is where I think the field is going to start to evolve more. Those patients that have a large saddle embolus, I think those patients using one of the larger bore catheters may be more beneficial. On the contrary, we know that people can still be very sick from the disease process, yet on their CT scan, the disease is much more in the subsegmental branches. Well, a large bore catheter is not going to necessarily be the best choice for those. So we do have some, as you said, that are smaller, that are more directional. And I think that, in my experience, those are the ones that I then choose a catheter that already has a predetermined angulation and it's smaller bore to be able to drive that and to decrease the clot burden better.
Okay. Last question is about when you do have somebody PE, you always scan the legs, see if there's any clot burden remain in the peripheral?
Yeah, it's a part of our algorithm at our hospital. We're always looking for screening.
And do you
DVT.
chase those DVT if they are?
We don't always. If there's phlegmasia or there's a proximal SFA DVT, so something within 5 centimeters of the common femoral vein, those I think are worthwhile because we know that the risk of those embolizing is a little bit higher. But patients who have residual popliteal disease, DVT, and don't have significant edema related to it, no, we're not chasing those. And I think that's just exposing patients to another procedure that isn't necessarily going to change their outcome at that time.
That's great. Thank you so much again, Zach. Again, great presentation and overview of the roles of catheter-based therapy for patients with VTE. Watch these videos and others on the YouTube channel. This is Shad Reyes coming to you from CVI 2025 in Austin.